Hi, I am Dr. Prashanth Chandra, Senior Consultant Physician, CARE Hospital, Banjara Hills. So, what is monkeypox? Monkeypox is a zoonotic disease. So, what is a zoonotic disease? Diseases which occur in animals and can be transmitted to humans are called as zoonotic disease. So, monkeypox virus belongs to a pox virus group and it mainly occurs in wild animals. This disease is endemic in African nations, especially Congo. So it was first isolated in 1950 in laboratory bred monkeys. So that was the reason why the name was given as monkeypox. But it's mainly endemic to African squirrels and rats. So how does it get transmitted from animals to humans? Is when the human gets in contact with the secretions of the animals which is infected, or the infected animal bites a human. So human to human transmission is very rare, and how does it happen is when you come in contact with the infected person, the person who is infected with the monkeypox virus, and you get in touch with the fluid which is coming from the rash or these blisters which happen on the skin, or through the respiratory secretions when the patient coughs and you inhale that air, or when you share the clothings, beddings or towel with that infected person. That's how the transmission happens from human to human. Very rarely sexual transmission is also known to happen. So monkeypox has got an incubation period of 5 to 21 days, and the first case was isolated in 1970. Majority of cases happen, as I told earlier, in African nations. It's endemic to Africa, and Congo being the country with highest number of cases. So usually it's a self-limiting disease and severity is very low. The mortality is less than 5%. It presents as fever, weakness and rash. Rash typically progresses from as a macule or a small bleb on the skin to water-filled rash, which is called as vesicle, to a pustule where the rash gets filled with pus and then it heals as a scab. So the how do we differentiate it from chickenpox is with the appearance of lymph nodes which are normally there in every human. They increase in size. Very rarely it causes a life-threatening encephalitis, that is the infection of the brain, or pneumonitis, infection of the lungs. These complications are seen in patients with other comorbidities like diabetes or kidney disease. So basically the treatment is supportive. You give analgesics for fever. The antiviral which is being tried out is not yet approved or not yet there in India. It's basically being tried out in US. So treatment is only a supportive treatment and isolation of the person so that the transmission chain can be broken. Thank you.